Our clinic itself is also a very large practice, so it's a good place to learn medicine. We have about 40,000 patients in the practice. They're pretty complicated, and you get a lot of help with managing this very complicated patient population. We have a variety of additional ancillary services. We have social workers on site. We have community health workers who can actually go and do home visits to some of the more high-risk patients. We have case managers who can help manage care and make sure patients are getting their medications, and if there's any sort of barrier like transportation or costs, that can be addressed. We also have pharmacists who can help patients learn about how to take their medications or use their inhalers, or just be around for help with any sort of medication question as well.
You know, we're fortunate to us, we have a very diverse patient population. I mean, obviously we're in Chinatown, so certainly a lot of members of that community come here too, but we get patients from all over the Boston area, from all levels of, levels and walks of life, both, socially and economically for sure. And I really like that balance, because, no matter where you go in medicine, you're going to have to deal with a huge range of people. I mean, everybody gets sick at some point in life.
And beyond that, I think, Tufts sets itself apart with this subspecialty system, having the opportunity to work on a service with an expert in cardiology or an expert in gastroenterology, infectious disease, and so on, really allows you to hone your skills in that field and become a very strong medicine physician in that field as well as overall. So I think it's a really great opportunity for learning and growing.
We're taking care of 9+ patients at a time, the MICUs are full, and you're constantly just learning. It's kind of go, 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 but you have so much support. The teams are fantastic, so you're learning a lot, you're doing a lot, but overall, it's crazy, but it's a lot of fun.
I think that Tufts' biggest strength are the people here. We are a small program, a small medicine program. We have a total of less than 80 residents. And so every individual is highlighted. And I think that our program works so well because all the people we have here are great people. From the residents to the fellows to the attendings, we all get along well, and we have a culture that is collegial, that is positive for education, that is supportive. We all have each other's backs.
There's a small class size, 25 in my year, 26 in the subsequent years now, which means that everybody's getting invited to every social event. Everybody knows not just their class, but all 3 years. Have the cell phone numbers of everybody that's above you, and that's really important when you're in a tough situation. You get to text right away or get a call right away. That was what I really stood out to me when I visited here, and I wish that the applicants got a chance to see.
Also, in terms of getting fellowships, it's tough in some areas. Cardiology, GI, ICU fellowships, etc. You need to be committed fairly early, and to get a good fellowship program in a lot of areas, you need to have done some research. So I tell people that's no problem here. I myself love to have it when I have a resident working with me in a research project. We don't even have to hook you up, because often during your internship year, you rotate into an area where you want to be a fellow, and that person that you're attending there, you have a discussion, and they lead you to someone or themselves that are doing projects that you'd be interested in.
But at the core, we are really doctors here, and I think coming to a place where every single specialist, every single generalist really is invested in taking the best care of patients are really the best role models for whatever career path our residents plan to go into, whether they plan to go into private practice and really focus on clinical careers, whether they plan to stay in academics and have academic pursuits in addition to their clinical care. They are going to learn from people that really take seriously their responsibilities in terms of patient care.